drug vlog. My name is Warfarin, and some people may know me from my brand names Coumadin and Gentoven. For my chemical name, it's too long for me. Instead, I'll flash it on the screen. For my therapeutic classification, I am an anticoagulant, and for my pharmacologic classification, I am a coumarin derivative. Just a reminder, remember to not let pregnant women use me. Why? It is because I am under the pregnancy category X. I am also used as adjunct therapy to reduce mortality, recurrent myocardial infarctions, and thromboembolic events post-myocardial infarction. Now for my mechanism of action. Since I am an anticoagulant, I disrupt coagulation cascade to reduce the frequency and extent of thrombus formation. I also inhibit vitamin K dependent activation of clotting factors 2, 7, 9, and 10, which are formed in the liver. I have no direct effect on established thrombi, and I cannot reverse ischemic tissue damage. However, I can prevent additional clot formations, extension of formed clots, and secondary complications of thrombosis. Pharmacokinetics. Absorption. For my absorption, I am rapidly and completely absorbed from the GI tract. For the distribution, I am highly bounded to plasma proteins, especially the albumin. For the metabolism, I am hydroxylated by the liver, mainly the CYP2C9, into inactive metabolites. And lastly, for the excretion, I am excreted unchanged. 80% of my dose is excreted via urine and 20% appears in feces. Indications. So I am indicated for prophylaxis and treatment for venous thromboembolism and related pulmonary embolism, prophylaxis and treatment of thromboembolism with atrial fibrillation, prophylaxis and treatment of thromboembolism associated with cardiac valve replacement. Contraindications. Here is a list flashed on your screen about my contraindications. My side effects of the human body categorized per body system. First is the central nervous system. This I could cause fever. Next, digestive system. I could cause anorexia, nausea, vomiting, cramps, diarrhea, mouth ulcerations, sore mouth. Next, we have genitourinary system. I could cause hematuria. Next, we have hematologic system. With this, I could cause hemorrhage with excessive dosage. Hepatic system. I could cause jaundice and hepatitis. For the integumentary system, I could cause dermatitis, urticaria, necrosis, rash, purple toe syndrome, gangrene, and alopecia. For others not categorized per body system, I could cause enhanced uric acid excretion. Nursing considerations. Before administering me, it is the duty of the nurse to review foods high in vitamin K. Why? It is because vitamin K is an antidote for myself, so patients should have limited and consistent intake of this food. And also, alternating the food intake could cause the PT levels to fluctuate. It is also the duty of the nurse to advise the patients to avoid cranberry juice and products during therapy. Inform the patients that my anticoagulant effect may persist for 2 to 5 days following discontinuation. It is also the duty of the nurse to advise the patient to read my medication guide before starting therapy. Advise the patient that venipunctures and injection sites require application of pressure to prevent bleeding or hematoma formation. Caution the patient to avoid IM injections and activities leading to injury. Instruct the patient to use a soft toothbrush and not to floss and shave using an electric razor during therapy. After, it is the duty of the nurse to advise the patient to report any symptoms of unusual bleeding such as bleeding gums, nosebleed, black tarry stools, hematuria, excessive menstrual flow, bruising and pain, color, or temperature change to any area of your body to the healthcare professional. The nurse must also instruct the patient to carry identification describing medication regimen at all times, and to inform the healthcare personnel caring for the patient on anticoagulant therapy before lab tests, treatment, or surgery. A nurse must also emphasize the importance of frequent lab tests to monitor coagulation factors.
Hi everyone, my name is Heparin. My brand name is Heparin, Heplock, Heplock UP, Heparin Lock Flash, Heflash-10, Liquamin, Hipacino, and Cabihim. My chemical name is... I have two drug classification. For my therapeutic classification, it is anticoagulant, and my pharmacologic classification is also anticoagulant. My pregnancy category is category C. My mechanism of action is heparin accelerates formation of antithrombin 3-thrombin complex. It inactivates thrombin and prevents conversion of fibrinogen to fibrin. I also stimulate release of lipoprotein lipase, which hydrolyzes triglycerides to glycerol and free fatty acids. Now for my pharmacokinetics, I am usually absorbed from the systemic circulation. For my distribution, I am extensively bound to lipoprotein, globulins, and fibrinogen. I do not cross the placental barrier. Now for my metabolism, I am partially metabolized in the liver to uroheparin, and I appear to be removed from the circulation and may localize in arterial venous endothelium. For my excretion, a small fraction of unchanged version of myself is excreted via urine. I cannot be eliminated via hemodialysis. I does not appear in breast milk, and my half-life is 1 to 2 hours. Now for my indications, I am usually indicated for deep vein thrombosis, pulmonary embolism prophylaxis, post-MI, cerebral thrombosis, involving CVA, left ventricular thrombi. I'm also indicated for open heart surgery, for disseminated intravascular coagulation, or to maintain patients of IV indwelling catheters. And lastly, I am indicated for anticoagulation in blood transfusions and sample. Now for my contraindications, I am contraindicated in pregnancy except in women with mechanical heart valves, hemorrhagic tendencies or blood dyscrasias, recent or contemplated CNS or eye surgery or traumatic surgery resulting in large open surfaces. I am also contraindicated in bleeding tendencies associated with CNS, hemorrhage, cerebral aneurysm, dissecting aorta, pericarditis, and pericardial effusions. Also for bacterial endocarditis and active ulceration or overt bleeding of the GI, GU, or respiratory tract. I am contraindicated in threatened abortion, eclampsia, and pre-eclampsia. Also for unsupervised patient with conditions associated with potential high level of noncompliance, also for spinal puncture and other diagnostic or therapeutic procedures. I am also contraindicated in major, regional, or lumbar block anesthesia and for known hypersensitivity. And lastly, I am contraindicated in malignant hypertension. Now for my contraindications, I am contraindicated in patients hypersensitive to drug with concomitant use of other heparin preparations. I am conditionally contraindicated in patients with active bleeding, blood dyscrasia, bleeding tendencies such as hemophilia, thrombocytopenia, or hepatic disease with hypoprothrombinemia. I'm also contraindicated in inaccessible ulcerative lesions, especially sa GI tract, and open ulcerative wounds, extensive denudation of skin, when there's ascorbic acid deficiency, and other conditions that could increase capillary permeability. I am also conditionally contraindicated during or after brain, eye, or spinal cord surgery, during spinal tap or spinal anesthesia, and during continuous tube drainage of stomach or small intestine. Although heparin is used, or myself is used, clearly hazardous in this condition, its risks and its benefits must be evaluated. I am used cautiously in postpartum or menstruating women, patients with mild hepatic or renal disease, alcoholism, or history of asthma, allergies, or GI ulcer, and those with occupations that have higher risk of accidents. For my side and adverse effects, these are categorized by body systems. For the central nervous system, mild pain. For the cardiovascular system, hemorrhage with excessive dosage. For the hematologic system, overly prolonged clotting time, thrombocytopenia. And for the other, irritation, hematoma, ulceration, cutaneous or subcutaneous necrosis. Hypersensitivity reactions, which includes chills, fevers, pruritus, rhinitis, urticaria, and anaphylactoid reactions. I, as a drug, also have nursing responsibilities. My nursing responsibilities before includes patient education topics for the patient on Warfarin, which includes medication adherence, INR target, importance of laboratory monitoring, and necessity of communicating changes in their medication regime to healthcare provider. I am also responsible before for diet education, which is critical because particularly for food that contains vitamin A. Now, my nursing responsibilities during includes adjustment of dose according to coagulation test results performed just before the injection. My nursing responsibilities also includes always checking the compatibilities with other IV solution. Also use heparin lock needle to avoid repeated injections and give deep subcutaneous injections, and do not give heparin by IM injection. Do not give IM injections to patients on heparin therapy, and warning. Apply pressure to all injection sites after needle is withdrawn, and inspect the injection sites for signs of hematoma, and do not massage the injection sites. My nursing responsibilities also include mix well when adding me to IV infusions, and do not add me to infusion lines of other drugs, and do not piggyback with other drugs into heparin line. If this must be done, ensure drug compatibility. My nursing responsibility after includes providing safety measures to prevent injury from bleeding. Also, check for signs of bleeding and monitor blood tests. Alert our healthcare providers of heparin use, and have protamine sulfate readily available in case of overdose. Each mg neutralizes 100 units of heparin. And another warning is treatment of overdose, protamine sulfate 1% solution. Each mg of protamine neutralizes 100 USP of my units. Give very slowly IV over 10 minutes, not to exceed 50 mg. Establish dose based on blood coagulation studies. And I guess that would be all for heparin. Thank you guys. Ciao!